Good afternoon. Thank you for joining us for the third Lunch and Learn of this program year. Basic Needs, Innovative Solutions, Food Insecurity in Mecklenburg County. Lack of access to healthy food has long been an issue in our community and has only been exacerbated by the COVID-19 pandemic. Given all that is happening in our world and especially in our nation today, I am especially grateful that you have joined us for today's discussion of this topic. My name is Patricia Massey-Hoke, and I am the Executive Director of the Women's Impact Fund. It is my privilege to work with our members as they develop and lead us through events such as today's. Special thanks to the Lunch and Learn Subcommittee of the Member Education Committee, led by Ashley Varnado and Karen Noble, who have worked to put today's event together. Special thanks as well to our community partners whose financial sponsorship supports the operations of Women's Impact Fund. They are listed here on my background. Finally, thanks to those members and friends of Women's Impact Fund who choose to make a gift to the annual fund, which supports critical operating needs of our organization. Typically, events such as the one that you are attending today would require a $20 ticket purchase. However, we are offering all of our activities without charge during the pandemic. If you are able, I hope that you might consider visiting womensimpactfund.org/donate to make a contribution to the annual fund at an amount that is meaningful to you. And thank you. Before we start the program, we want to understand a little bit more about the members and guests who are joining us today. On the screen, you will see a poll that has two questions regarding your knowledge about local food insecurity and what attracted you to today's event. Please take a moment to complete the poll to let our speakers and the Lunch and Learn team know a little bit more about you. Great. It looks like a lot of you have some knowledge and want to learn more. I know we also have some people that work in this space full-time professionally, and we're really happy to have you with us today. And it looks like on the whole, subject matter of the topic is the thing that's most attracted folks to today's event. I'll give you just a few more seconds on the poll. Great, thank you. Now I would like to hand off our presentation to our moderator and our panelists and invite them to join me on the screen. Today's moderator is Michelle Cottrell. Michelle joined Women's Impact Fund just last year and has truly jumped right in with 2 feet. In addition to being a member of the Lunch and Learn Committee, she is a part of our Diversity and Inclusion Task Force. And when she's not volunteering for Women's Impact Fund, she is a data analytics and technology consultant with deep expertise in Salesforce. I'll now turn it over to Michelle to introduce our panelist.
Good afternoon. I'm excited to moderate today's session, Basic Needs, Innovative Solutions, Food Security, Mecklenburg County. During the COVID shakeup of 2020, I personally became significantly more aware of how I procured food as I shifted from on-demand grocery shopping and eating out to planning online grocery orders and takeout. I tried to shift my purchasing to smaller local providers. During this time, for many in our community, getting enough food was and still is a challenge, as sites for meal distribution like schools and community centers had to change their model overnight, and income loss led to an inability to purchase groceries. Although COVID has exacerbated the issue, food insecurity is a long-term challenge in our community. I'm delighted to introduce 2 panelists who have been working in this arena for quite some time. Abby Wyatt is the Food Security Coordinator for Mecklenburg County Health Department. Prior to this role, she was deep in food production and distribution network, running the Davidson Farmers Market. Dr. Nicole Peterson is an Associate Professor of Anthropology at UNC Charlotte and is currently leading the 2020 State of the Plate assessment of the Charlotte area food system, which examines the needs and assets of the local food system before and during the COVID-19 pandemic. Before we dig in, a couple of notes on structure. We'll go through the presentation in 2 parts with a time for Q&A in the middle and at the end. You can add questions to the chat box at any point in the presentation. After the event, we'll be sharing the presentation with heaps of links to statistics, current initiatives, and how you can get involved. Let's dive in now, shall we? Abby? Oh, Abby here.
There we go. Yeah, it was, sorry about that. Hi, so thank you for the introduction, and we are excited to dive right in and present. So as you can see, we're going to be talking about food and nutrition insecurity in Mecklenburg County today. Michelle did a great job at introducing both Nicole and I, but we also want to provide everybody with our contact information so that if anything comes up or there's any questions after the presentation, we're more than happy to chat with everyone. And then we'll pass it. Oh, go ahead. Nope, I was just going to pass it right over to you, Nicole, so kick off.
No, as you see, we're splitting the presentation, so we apologize for any bumps going on, but we have been working together on some projects over the past year or more, and are just really excited to talk about this. So as you can see, we're thinking about food and nutrition insecurity and what that looks like. And there's a couple of ways people talk about it. So this first term you can see up here in terms of going through the basics is just food insecurity, just a lack of consistent ability to access food. And it can be due to a lack of income or cost of housing or transportation issues, things like that. But there's other ways that we talk about food insecurity as well. One is just food access. So we can talk about someone being food insecure. We can talk about them lacking access. And in this way, kind of what are the barriers, what resources are available or not available in terms of being able to get to the needed food and nutrition that people need. And then the third way that we'll talk about today, though there's a couple others as well, but the third one today is this idea of food sovereignty, which gets to the right to access food. So what rights do people have to access food, to produce their own food, to really be in charge of their own food system in a sense. And so this is one of the newer terms that's being used to really talk about how people are accessing food and what kind of barriers they might face to really being able to have control over their own food system. Now, as we see in North Carolina and the US and Mecklenburg County in particular, we've got some food insecurity rates here, just to give you a sense of what things look like. At the national level, about 11.5% of households are food insecure, a little bit higher for households with children, and then around 7% of senior citizens are food insecure. And we see most of those hold with a little bit of variation at the North Carolina level and then at the Mecklenburg County level. And so we see that households with children in Mecklenburg County are around the same as the national level, as is the general food insecurity household percentages. But we also see that there's a little bit of a higher than the national level of senior citizens who are food insecure. So these are all very concerning, and we certainly would hope that nobody would be food insecure, but we just wanted to give you a sense of what the statistics look like on this. And of course, this is pre-COVID. This is data from 2019. We know that things have shifted immeasurably over the past 9 months. So we don't have any statistics right now in terms of that. There's a link here on some additional things from Feeding America that they're looking at, but we want to give you a sense of what's changed. And so we can see here some impacts from food security that we've actually seen in the Mecklenburg County area. There's been an increase in SNAP benefits through the CARES Act funding as a response to increased demand for SNAP, which is the food stamps, food assistance program run through the federal government. We see food boxes that have been distributed through CMS and other local organizations, and some of that's through some of that federal funding, and some of that is through local efforts. But overall, we just see an increasing need. And I've got some data here, just a little bit from Loaves and Fishes and Feeding America, Loaves and Fishes and Second Harvest, about the ways that they've seen increases in the people that are asking for support. And we've also seen not just increasing demand, but also some innovations that I think are worthwhile and when we think about food insecurity, and that people are adapting to the current situation and trying to make things work more effectively. And that includes produce and dairy food shares that are going on, and new feeding sites or soup kitchens that are popping up in during COVID to try to address some of this need. So it's great that people are seeing that there's this increased need and that they're making some efforts to address it through some really innovative changes there. And we do know there's some contributing factors to food insecurity. And this is from our 2015 State of the Plate study. So it's a little old at this point. We're redoing the study now to really understand what's happening, particularly under COVID. But we saw some limitations to access, like to grocery stores, particularly within walking distance. And then we also see cost as a primary barrier that a lot of people talk about. We know finances are a big part of food insecurity, but people are also looking for fresh and other values that their closest stores may lack. So a comfortable environment or just being friendly, things like that might also be important. And then there's particular areas of risk that we identified in 2015, including the Brookshire Boulevard corridor, the West Boulevard corridor, and the Albemarle Road corridor. So all of those are areas that we have have been on our radar as areas of higher food insecurity for a variety of reasons. Other challenges that we've seen, awareness, of course, is a big one. So just getting the word out there about what's available and what people can do. Stigma, there's a sense that people feel stigmatized in asking for support. And so trying to reduce that is important, as well as recognizing limitations for time and transportation for people. So as we plan for transportation in the city, how is that going to interact with food insecurity and the ability to go and grocery shop and bring your things home on the bus or on the light rail? And then there's, of course, competing costs for housing and healthcare that are really important. And here, just with everything else you see, I think all of you can tell the crescent and the wedge is here for income and for where grocery stores are. You see a lot more grocery stores in that wedge area than you do in other places. And then you also see nutrition assistance really in that crescent part of our city. So just to look at it geographically, there's some really interesting patterns that I think can help you understand what's going on and how to make those connections. Abby?
Yeah, so we'll move on to the health implications of food insecurity and how that impacts communities overall. So when you're looking at data from the county, it consistently shows that communities that have higher rates of food insecurity also have higher rates of chronic disease, obesity, heart disease, and that all relates to the bigger picture of food insecurity and all of those pieces that pull into that. The intersection of all of the different elements of food insecurity can be shown as a cycle. So if we move to the next slide, it shows this circular motion of food insecurity and all of the elements that go into it. When you talk about food insecurity in communities with higher rates of food insecurity, you have to look at the bigger picture of how and why this is happening. It can tend to be a chicken and an egg situation a little bit. So you look at food insecurity as coping strategies. A lot of communities have to make decisions, as it shows here. Do we buy food or do we pay our rent? Do we buy food or do we pay that bill? So it looks at that as how it impacts the full circle of the diet that you are eating and how that impacts your health and leads to chronic diseases, which if you have an increase in chronic diseases, then you're going to be going to the doctors more frequently, which could lead to higher bills, which can make it harder to pay your bills, pay your rent, pay for all of those expenses that you have in life. So it just continues to go in this circular motion where all of these stressors in life are intertwined. So we can go to the next slide. So on that note, we'll move into food and nutrition assistance programs. So the first one we're going to talk about today is SNAP, which stands for Supplemental Nutrition Assistance Program. This program was formerly known as food stamps. It is a federally funded program that provides additional resources to low-income families to purchase food. So when we say food, there are limitations around what can be purchased with SNAP benefits. You cannot purchase personal hygiene items, you cannot purchase alcohol, tobacco, or hot, ready-to-eat meals, which has been a topic of conversation, especially during COVID. So what that means is if you go to a grocery store, you cannot buy, pizza from a pizza bar, or in a lot of cases, even like a rotisserie chicken that's already cooked. Those are considered hot, ready-to-eat meals. Those are not eligible for purchases with SNAP. And I know there are some governments and some legislation that they're hoping can change that hot, ready-to-eat meal restriction. They can, however, SNAP benefits be used to help with purchasing a share in a CSA, which is a community-supported agriculture program that a lot of farms do, where people pay up front. So you would pay a certain portion, and then you would receive a box of food on a weekly basis. I have seen farmers that have worked it out with community members that are using their SNAP benefits to pay for the CSA and allowing them to pay for it weekly, or working it out so that it can work in their budget. But it is allowing community members to use those SNAP benefits to purchase healthier food items. So SNAP is the nation's largest food assistance program. You can see in 2019, they spent, the federal government spent $63.5 billion on SNAP, for the SNAP program, which increased 35% going into 2020 with an $85.6 billion. So it is definitely the most utilized federal food assistance program. As of September 2020, there were 60,000, just over 60,000 households that are receiving SNAP benefits. So that's where we stand in Mecklenburg County right now. The next program, so no, you're good. I'm jumping onto WIC already. So this is a great slide when we talk about SNAP and how it impacts the greater community. So when you look at the economic benefit of SNAP dollars going into local economies, I like to point out specifically the use at farmers markets because that is keeping it much more localized. But for every dollar generated through SNAP, I think it's around $1.65, $1.70 is generated in economic development. So this shows the impact that it has. That's the financial piece. That middle square shows all of the different areas where that funding goes and the areas that it is helping to redistribute those funds and grow. And that last square on the right demonstrates how families can stretch their budget. When you look on the left without SNAP, there are certain areas that they, again, going back to that slide, you have to make decisions. What can you purchase? And with additional funds coming in from SNAP, it allows them to purchase hopefully healthier food items, but just to get food on the table and then use those funds that they would otherwise be spending on food to go towards education expenses, medical expenses, housing, things along those lines. The other assistance program is WIC. WIC is also a federally funded program, and this is geared specifically towards women with young children. So it is pregnant, postpartum, and postpartum breastfeeding moms that have children that are up to age 5. Fathers are eligible to enroll their children. So if the benefits will be a little bit less, but the children themselves can be enrolled in WIC and they can receive funding for that as long as the children are under the age of 5. So with WIC, this can be used as a supplemental program. A lot of families that qualify for WIC also qualify for SNAP. And this is where they can purchase diapers, formula, baby food. Certain items that are not eligible through SNAP are eligible through WIC. You can see the funding for this is significantly less than what it is for SNAP. WIC has been traditionally over the past few years underutilized, and so the funding has decreased. But it is still a program that is accessible that we hope to see grow and be a little bit more utilized. So we'll go into SNAP myths, facts, and fictions. There's a lot of talk out there often about SNAP. So we'll go ahead and start with the first myth, that people on SNAP don't work. That is not true. Current rules limit SNAP benefits to a 36-month period. So to receive SNAP benefits, this changed a few years ago. There was some new legislation that went through where if you cannot prove that you are looking for work or participating in a vocational education training program, for a total of 3 months, they will stop your SNAP benefits. But I'm getting off track a little bit, sorry. The majority of people that receive, large percentages of people that receive SNAP benefits are working. It is an additional income stream for these families. The majority of SNAP recipient households the majority of SNAP recipients are children. in homes, and they do have at least one parent for the most part that is working. So we'll go on to the next myth, that food stamps is a welfare program. It is actually not a welfare program. It is a federal program to increase a family's ability to buy more food. It is not in any way affiliated with welfare programs, and the statistics have shown that the average recipient receives SNAP benefits for 8 to 10 months. So it is looked at as a stopgap, and that's what they're hoping, is that as people do lose jobs or aren't able to receive a living wage, then they can use this as a supplemental program to help their family in the meantime. SNAP is just another bloated government program. That is not true as well, obviously, as it's a myth, but the administrative expenses for SNAP are around 5 to 8%. So the majority of the funding that goes to this program is spent directly in benefits to families. They also use a portion of it for education. SNAP Ed is a program that is directly linked with SNAP benefits, and that was created to work with families to teach budgeting, food storage, recipes, and how to manage the food that's coming in a healthier way. The next one, SNAP is rife with fraud and abuse. So as it says here, it has one of the most rigorous quality control systems of any public benefit program. It has been shown that the error rate is currently at an all-time low with less than 3%. It's very hard to fraud this program right now, especially since it has moved to electronic and it's no longer paper vouchers or anything along those lines. The card itself was shown on one of the previous slides, is essentially a debit card. So it has a PIN number, which is private, and a lot of places do require a photo ID in addition to the SNAP card. I am not eligible for food stamps because I do not have an address. This fact and the next one I put on here because this was something newer that I learned that I found really interesting, is that you can in fact receive SNAP benefits if you don't have a fixed address. And if you do not have a valid state issued identification card. So if you go to your local DSS office and apply for SNAP benefits, they can work with you to still receive SNAP benefits.
So, great. Go ahead.
Yeah, go ahead.
I was just going to ask a couple questions.
Mm-hmm.
So at what level do decisions about SNAP get made? Is this something that Mecklenburg County can make decisions about how they want to apply their dollars? Is this state level? Is this federal level? For example, to me, it makes a lot of sense that when we have a hurting restaurant industry and people that might prefer the convenience of a takeout meal, that it might make sense to try and expand our SNAP dollars to that. How would something like that potentially happen?
Well, changing the places and ways that they can utilize their EBT cards and the SNAP dollars, that's more of a policy change. So there are federally mandated guidelines and rules around SNAP as it is a federal program. So it will be passed down from the top. I think that people are looking to hopefully change that, but those types of decisions would be made from the top down. As far as what they're able, or the number of benefits, the amount of benefits, those are individual. So a resident would go to the local social services office and apply for benefits through there, where that staff will look at the, again, federally mandated requirements, and the person will receive the benefits that they qualify for based off that information.
And we had a question. There are roughly, you said 60,000 people receiving SNAP in Mecklenburg County. what percentage of the population is that? I did a bit of rough mental math, which is not really my strong point, and it's less than 1%.
Well, for a point of clarification, it's 60,000 households.
60,000 households.
Yes, so that does not break down to the people.
Okay.
If I remember correctly from the information that I have, I don't have it on hand, it's on in my email, but I believe it's somewhere around 200,000 people total
Right.
are made up between those 60,000 households. So I don't have the exact percentage of the population, but that's definitely something that I can get, and we can include in a follow-up if needed.
I just did a quick look at the number of households, which they estimate to be about 411,000. And so that's about 14.5% of households. And that corresponds to the food insecurity statistic of about 12%, with slightly higher 15% for households with children. So it's about in the ballpark of what you expect, that we know that there are a lot of people who fall through the cracks and aren't getting SNAP, even if they are food insecure.
Okay.
And for some, food insecurity can be helped by SNAP. So hopefully, you're getting SNAP and that helps you not be food insecure.
Great. Well, this seems like a great place to move on to local programs. Abby?
Sure. So moving on to Mecklenburg County specifically, as introduced, I am part of the food security team. So there are 4 of us on the team that are working on several different projects. So the first project that I'm going to talk about today is edible landscapes. So within our team, we work with, right now it's primarily faith-based organizations. We are looking to expand that out to community groups, possibly different schools and YMCAs and community centers, as I said. So Edible Landscapes works with Tree Charlotte and North Carolina Extension to create to utilize the space and the land that these organizations have to build orchards and raised garden beds. So they plant fruit trees, some bushes, and again, raised garden beds that these organizations can use to feed their congregation. I know there's one church, Reeder Memorial Baptist on Beatty's Ford, that has a food pantry on site. They received an installation about 1.5 years ago, and they use what is produced from their edible landscape area and put the food directly into the pantry for the community members. So it's just one way to address food security on a smaller scale, in addition to assisting with the tree canopy here in Charlotte that has come up from time to time as it is decreasing slightly with all of the development. This is just a way to kind of work to build that back. So in addition to edible landscapes, we also have our Healthy Corner Store program. And this kind of links back to part of that cycle that was discussed earlier, where healthy corner stores tend to be more prevalent in areas where there's not grocery stores. So communities will walk to their local corner store to purchase food items. The food items in corner stores traditionally are higher priced as they're independently owned, and it is a challenge for those owners to have a good income for themselves based off the margins. They tend to be higher processed foods, higher in sodium, higher in sugar. So this program looks at ways to work with the store owners to slowly implement healthier options for the communities. One of the biggest challenges that we have seen with this program is refrigeration. A lot of these corner stores have, the traditional beverage storage cases, which are not cheap. And so when they bring in produce, they don't have a place to store it. So we have been working with some of these corner stores to try to get them refrigeration so that when they do purchase produce, they do have a place to store it. You traditionally see the apple or the banana right at the checkout line, and that's it. So we would like to expand that. Our corner store program is currently working with, I believe it's around 25, maybe upwards of 25 stores right now. So they are evaluated and monitored They work closely with the two women on our staff who are awesome to whether it's the baskets like you see here, and whatever else works for their store. And when they meet all of the requirements, they receive a certificate, which you can see in the picture on the right, and they are listed on the state website and are designated a North Carolina healthy food retail designation location. So the last program I'll talk about, bear with me, I could go down a rabbit hole on this for a long time. This is the program that I specifically work on within the team, is SNAP at farmers markets and SNAP benefits. So in 2019, when we started this program, there was one farmers market in Mecklenburg County that was accepting SNAP benefits. We have worked to get that up to 10, which is great. And we are super excited about that and would like to continue and hopefully have all 20 of the county farmers markets participating in the SNAP program and hopefully the double bucks. So in mid to late 2019, we received funding from Blue Cross Blue Shield and partnered with Nicole and Charlotte Mecklenburg Food Policy Council to implement a double bucks program. So what that does is when a community member shops at a farmer's market and uses their EBT card, the market can match their purchase dollar for dollar up to $20. So if a community member comes and spends $10, they'll receive an additional $10 at no cost to them. So it's essentially makes their purchase 50% off at the market. This is what we would like to see expand and continue, as it's an incredible program, and nationally it sees success in pretty much every place that it is implemented. So it's a new program. It was set to kick off in March of 2020 as the season kicked off, but we all know how that went. So we had a really great year with it, even though COVID happened and a lot of the markets were delayed. We had one that didn't open at all. It was really hard on the farming and the farmers market community those first few months, but we've had an incredible year with it. And so we're really looking forward to going into 2021, knowing what we know and having the exposure that we've had. So with this program, again, we work with Food Policy Council and are hoping to really see it grow. We did a couple of additional programs through Food Policy Council and the great work that they did, where we were able to add a couple dollars on. We did a refer a friend program so that if a SNAP shopper brought a friend, they would each get an additional $5. So we're looking at ways to kind of work with this program to draw people out and promote. So the slide that's up right now, this is the front and back of a brochure that we've created that shows all 20 farmers markets. It lists who accepts SNAP, who participates in the double bucks program, the public transportation routes to get to each market, and their hours of operation. The flip side of this brochure details all of the information, how to use your SNAP benefits, or how to receive the tokens at the market, what you can use and purchase at the market, how to apply for SNAP, what SNAP is. There's also a note that I really like under the transportation section that Senior Services with Mecklenburg County added farmers markets to their list of transportation. So if a senior citizen calls and would like transportation to a market, they will bring them to and from a market, which is a really great, great resource for seniors. So we have that. We can move to the next one. So that's it. We're going to pass it back over to Nicole.
Thanks, Abby. And yeah, it's been really great working with Abby, and we have a staff member for the Food Policy Council who works on this project exclusively, and it's just been really great to see it grow, and we're expecting it to grow much farther. But I do want to talk a little bit about what the Food Policy Council does. So we're a nonprofit, and obviously we are a food policy council, so thinking about policies, but we also do a couple of other things. We see our vision and our mission as to advocate for policies that help us build a better food system, and we do that through a couple different things. We do that by having events and discussions around the food system and food topics. In fact, I think we talked about our SNAP Double Bucks program when it started, and Abby's always been great to come out and help us understand how SNAP works at the farmers market. We build relationships through the different kinds of projects we do and the different programs, like with the this project with the Double Bucks has been with the city, it's been with Blue Cross Blue Shield. We've talked with a lot of different stakeholders around the community, including American Heart Association and some of the other funders as well. And so it's been great building relationships that way. We also educate, advocate, and communicate around policy issues. And that includes some of the work we do that I'll describe in a minute around research and state of the plate, which also gets us to this acting as a primary information source. So trying to see what's out there in terms of what we know about the food system, things around food access, but also other parts of the food system, consumption, distribution, waste, things like that. So this is what I was talking about. We did a project in 2015 that I mentioned earlier called State of the Plate that was trying to understand what is the state of our food system in Charlotte. And we had a couple of pieces of this. We looked at where these food insecure places might be through some mapping exercises. And we also looked at some of the different rates of food insecurity, and we did some interviews just to try to understand what's happening. And so we were able to put this on our website, and so it's there for those of you who are interested to dig into in a lot more detail. But as I mentioned, it's 5 years out of date, and we'd always intended to repeat it in 2020. So despite the pandemic, we started planning in 2019. And what we've gotten to this far is we've worked with at this point, over 100 organizations and individuals to figure out what we want to ask, what we want to do, how we want to assess the food system. And we've broken it down into 4 different points you see here on this top left square. Organizational business needs under COVID. Right now we have a survey that we've circulated with organizations about what their needs are, what changes have happened under COVID to try to understand that better. And we'll also be doing interviews, more interviews with organizational leaders on that. We're also looking at household experiences of food access. So we're starting an interview phase in January where that's now January and February, to talk to households in different parts of the city about what their experiences with food have been during COVID. So as a qualitative researcher, talking with people gets us a really much more information than just asking if they're food insecure or not. We want to understand what's happening and the processes involved, and that helps us understand that cycle that Abby presented earlier. And then the last one is kind of our last piece of this we'll do at the end, which is what is our vision for the food system? A lot of us react to food insecurity or react to other challenges in the food system rather than thinking about what we want the food system to be. And as a group of organizations, and those even that we haven't been involved with so far, I think there's an opportunity to come together and decide what we want our food system to look like. So I encourage you, if you're interested, to come and join me. You've got my email address at the beginning of the slides, but I would love to have everyone who's interested come help us figure out what our next steps are and what we want to do, because it is our food system and we need to figure out the best way to address the kinds of gaps and needs that we know are in there. And so we really think that that's a really important thing. Our other major effort is Food Corps, which is our program that we do with elementary schools around Charlotte, around education, with nutrition. We have some some gardens that the students help us to do, and we've often got a Food Corps member or two in Charlotte to help us with these. Right now, we're working with Mary Oaks Elementary, with the Queen City Teaching Farm, which is one of the new programs in town with Jody Francisco, and with Farm to School with CMS, Child Nutrition Services, to really give these students a chance to learn about what vegetables look like, how you grow them, how you eat them, to do tastings, all kinds of really exciting things to do. So it's been one of our signature programs for a while, and it's great that we're able to continue that work as well. So my next slide is actually just to highlight some of the other things that are going on around the food system. As I said, we're working with over 100 different organizations and individuals, but it's possible we're missing some. But I wanted to give you a chance to see who we know about, at least a partial list. We know there's more than this, but if there's someone who's not on here and you think we should know, just reach out, let me know. Like I said, this is great for our State of the Plate assessment, as well as just our general kind of connecting people across the food system. So you can see here just a list of the different ways that people are trying to address food insecurity in Charlotte. This doesn't include a lot of the other partners we have, but at least those trying to understand food access and eliminate it. And that includes everything from the Bulb that does pop-up markets to Seeds for Change, just trying to put together a food cooperative on the west side, to Camino that does a lot of work around with their pantry and nutrition education and things like that. So there's a wide variety, including some of the big ones, Loaves and Fishes, Second Harvest. Sorry, you can see the list here, but we're really excited about the different kinds of opportunities. So I do want to take just a minute and let you know that we're having a question and answer session coming up soon. So if you'd like to add to the chat your questions, we're happy to answer them. And we also, from Abby and myself, we want to know who's missing and what we should be doing next, aside from what's on our next slide. So our next slide is our calls for action, kind of where we think we can put some energy into the food system given what we know about it. We know there's some organizational needs. We talked about funding a little bit in terms of the percent that goes towards SNAP versus kind of the administrative needs. We know there's a lot of needs for funding, and some of that is those administrative needs. To be able to run programs like Double Bucks, you have to have someone dedicated to it. And it seems, you'd love all the money to go to the recipients, but there's really no way to run it without people. So those kind of unrestricted funds are really important for organizations, as are expertise coming from board members. So I just rolled off the Food Policy Council, but I'm staying on to work on State of the Plate. But we're always looking for great people who have different kinds of expertise around social media, around budgeting, all kinds of things, right? Grant writing or assessment. Those kinds of skills are really, really helpful. And we know our community is filled with people who have them. And if they have some time, it'd be great to volunteer a couple hours a month on these kinds of projects. And also, if you don't have expertise, but you know people who do, maybe talk to them about how they could get involved. So really building social networks of expertise as well. Now, I do have some more practical planning needs that we've identified through the different kinds of studies and discussions we've had over the past 5 to 10 years. And the first one is just moving past this language of food deserts. So I talked about food insecurity, food access, and food sovereignty at the beginning. A lot of people talk about food deserts as places that don't have a grocery store. But we know there's a lot of other things in these areas. Sometimes there's a lot of fast food, sometimes there's corner stores, sometimes there's community gardens, sometimes there's smaller businesses that get left off of the map. And so by eliminating that sense of it being a desert, we also don't, what we've seen is people are really offended by that term because they don't feel that they live in deserts. They feel they live in communities, and their communities have a lot of assets. And so an asset-focused look at food security and food access, I think, is really important. So anyway, I like to just talk a little bit about that because it is something we've seen over and over again in the food communities. And then also working with community leaders to make sure the solutions meet the needs of communities. How many times do we all have really great ideas, but it's not necessarily connected to what the communities who are affected need or what they're going to benefit from? So really having those conversations early on can really prevent a lot of issues down the road, but also really more directly help these communities. So working on things like zoning and incentives and grants. So really finding out what kinds of zoning, what kinds of incentives, what kinds of grants are we looking for. Investing in convenient and walkable infrastructure like grocery stores, farmers market, healthy corner stores, community gardens. And again, talking with the community about what they need of those. And as we saw, SNAP and WIC could always use some more funding. It's been good that we were able to increase it during the pandemic, but we know it's not meeting all the needs still. So those kinds of things are important, as well as things like the healthy food prescription programs that some of the hospitals have. So alternative ways to meet the needs to make sure people can get the fresh fruits and vegetables and nutritious food they need. And then finally, some people don't know how to cook. I am not the best cook in the world, so it's always helpful for me to learn, what do I do with kohlrabi? What are the ways that I can deal with these vegetables I may not be as familiar with? So even just the cooking demonstrations we see at farmers markets, or through programs like the American Heart Association has, are really great ways to show people how to eat healthy, but also how can you do it with the ingredients you have on hand. So I just wanted to, as I said, we've got some questions and answers. If you have questions, we have answers, hopefully. And we'd also love to know, what are the kinds of things that we're missing? What can you help us with, since you all have some expertise in different parts of the city and different parts of maybe even the food system? Let us know how you want to connect and help us. So thank you.
Well, great. Nicole, I also learned a lot from joining a CSA about vegetables I had never seen before. Kohlrabi is a revelation. So we have a lot of questions here about the farmers market and the farmers market program, so I'm going to bundle a few of them. One is, farmers markets tend to be in more affluent areas. They're maybe not that accessible. How do we get more farmers markets that are in neighborhoods? Another is, let's say my local farmers market isn't currently accepting SNAP double bucks. How can I advocate for that? And then we have a question about how do farmers markets pay for the matching responsibility? Are the prices on the produce raised to compensate?
Okay, so let me break that down. I'm going to work backwards real quick. So the SNAP Double Bucks program is 100% dependent on funding. So that is where there are federal funds that come out. There's a grant program. It's called the GusNIP grant. We are not a current recipient of it, but that is where a lot of these programs that are run nationally receive their funding. There's also private partnerships, which is what we have created with Blue Cross Blue Shield and American Heart Association, and the wonderful work that they are supporting. So it is funded through grants and partnerships like I just described. So the prices for the farmers do not change. They keep their pricing what they have set it at, and then the market is funded through, the market is given those funds, so they will reimburse the farmers. So the way it works at a market is when a shopper comes and uses their EBT card, they're given tokens. There's wooden tokens that are distributed, those at the individual vendors as if they're cash. So if you, so you would use it the same way, and then the vendors then turn those tokens into the market, and then the market reimburses them through those funds. So that's just kind of the quick overview of how that works. So everything stays the same for the farmers, and the markets receive the funding individually. Advocating for your market if your market doesn't accept SNAP, shoot me an email and I can talk to you about that. I'm have spoken and am working with every market in the county. They all are unique unto themselves. Every market is different. Every market operates differently. Some of them have paid staff. Some of them are run by organizations. Some of them, so they're all run individually and they have unique challenges. So there might be a reason why your market does not accept it. There might not be, and I might be working with them now to try and move that forward. So I would love to hear which market which one you're thinking about, and I can give you whatever information I have. What was the third part of that question? I'm trying to work through this.
Oh, farmers markets in affluent neighborhoods. Yes. How do we get more?
So that is a tricky one. So you have to look at this from two different perspectives. So we're looking at it from the farmer's piece, where this is their income, their livelihood, this is their job. So they need to be assured that they are going to make a certain amount of money to survive. There is a large percent of farmers themselves that receive SNAP benefits and that are traditionally very close to poverty, if not in it. Farming is not a lucrative profession. So they would prefer a lot of times to know that they're going to make a certain amount of money if they're going to participate in a farmer's market. So starting at a new farmer's market or expanding to an additional farmer's market is always risky for farmers. So when you're looking at it as it relates directly to this, we are asking farmers to take a risk to go to a low income neighborhood where people may or may not be able to afford the food that they have, because they have to make a certain amount of money. And when they price their produce, it's not to make money, it's to make a little bit of money. It's just to cover their costs and make their wage. So it's challenging in that regard. So that is where we're hoping that Double Bucks will allow the community to come out and purchase more of this healthier local food, because it is discounted, which will then allow farmers to come out if they know that the community is going to participate in their market. So that's kind of the challenge there. There's also only so many farmers. So we have 20 farmers markets right now, and they do still have to be on site and plant and pick and grow and maintain. So there's a limited number of them to go around depending on the day of the week that the market is set up. So that's also another challenge.
Great. Mary Long actually just commented on that as well. So time spent behind a table for farmers is not time spent on the farm itself. And if you go to a market of minimal sales, it's very costly for them. Mm-hmm. So how do we think about reducing the stigma about receiving these benefits? How do families find out about the benefits? Do they get it? Do they find out from doctors and pediatricians? And what about partnering with health clinics Charlotte Community Health Clinic have had a partnership years ago that was very popular.
Yeah, that's a big piece of it. I spent most of October, November, and December going to a lot of the Loaves and Fishes food shares and personally handing out the information, that flyer that previous slides, and a lot of people in the community just don't know about it. So I think that is something that is on all of us that are in the space to work with health clinics, food shares, YMCAs, doctors' offices. That was, again, all on my radar for 2020. So we're working on finding ways to get this information into more locations, into, Charlotte Mecklenburg libraries, YMCA, into the schools. So that's something that is happening slower than I would have liked to have seen it happen, but it is being discussed. And I think that is something that we can all work towards, is when you're out in an area, if you think it would be a good spot, talk to them about it. And if they're open to it, shoot me an email and I'll give you brochures. And, if it takes everybody kind of looking around once you have this information on how we can get that information out there.
And community health clinics, do you have any partnerships with them, or is that something you all are thinking about?
The county works, we have our offices, public health clinics. So there's information there, but we aren't working with a ton right now. We started talking with DSS earlier, about mid last year, about getting more information out through their channels. I've worked with Senior Nutrition, and we're trying to get some information into their congregate sites and things along those lines. So, yeah.
And we have worked with CMS on some of the feeding sites. I think we used some of the brochures there. And then one of our board members is at Atrium Health. And so we found that partnership, more informal, to try to, make sure that they're aware of what we're doing, and just trying to build that awareness of the medical side of things as well. So, as Abby said, we're working to try to get out there. We do need the staff to be able to do that. And that's one of the challenges too. It's how many hours a week Abby can get out there and talk to people.
And there's a lot to digest, I love that pun, in this program. Can we go through food sovereignty a little bit more and really dig into that term?
Yeah, and I saw a couple other questions that I'm going to address at the same time around some innovations and kind of places, organizations that have really made an impact in the area. So food sovereignty is this idea that to understand why people don't have food, we have to look at not just their access through traditional, like the grocery stores or things like that, but also what they can actually control as a community. So if your community, for example, is waiting for Food Lion or Harris Teeter to come in, you may be waiting a very long time. So there's only one major grocery store on the west side, and that's the Food Lion on Betty's Ford Road. So if you're going to wait for another grocery store to come in, you're just waiting. On the other hand, you have Ricky Hall's group Seeds for Change that are trying to put in a grocery store on the west side. And so that's that sovereignty idea, that if you own it yourself, if the community runs it, the community also benefits from it in terms of jobs, in terms of the ways that you can decide what your store is going to look like or what it's going to include. And so there's a couple of models out there like Seeds for Change and the Rick's Market that are really trying to do these community run markets that are trying to address food security. And those are two of the really the kind of standout projects that I know about right now. They're both looking for major funding, and that's one of the biggest challenges. So when we're talking about $20,000, that seems like a lot, but these are millions of dollars that are needed to really start these projects. And so that's one of the biggest stumbling blocks, is that kind of money. But I did want to bring up another project that's happening on Betty's Ford Road, which is the Rosa Parks Farmers Market. And they're not affiliated with us, and I don't think they're affiliated with the health department either. And they run their own SNAP Double Bucks matching program. So they do have SNAP, but it's not through our program. And they've done that through community partnerships. They've done it through, a lot of the efforts by, a couple people who are part of that community. And that's a farmer's market that has been very successful because the community wants to see it continue. And that's part of that sovereignty idea, that community buy-in, that benefits for the community, and really putting the community first in some of these efforts. So that's, a fantastic work by Vivian Stewart to really pull that together along with her collaborators.
Now, State of the Plate, is that a local initiative or is this something that a national assessment that we're just doing locally?
This is completely local. It's by the Food Policy Council here. Other food policy councils have done similar kinds of assessments to understand their, the needs of their food system. But this is something we started in 2010 at a small scale and then ramped up in 2015. And then we're doing even more now in 2020, even with COVID. So we're, we've gotten, funding for these first two phases, and we're hoping to continue for, we aren't able to do the survey right now because that is, we'd love to do it, but right now we feel like it's hard to do a survey under COVID and get reliable, kind of comparable data. But that could be something in the future too. But it is, it's an idea that's out there nationwide in terms of understanding the food system. But for us, it's something we've done internally with the Food Policy Council to develop it in partnership with all these other organizations around the Charlotte area, which it's been really great. Every time we have a meeting, I walk away just having learned so much about what people are doing and how we can better improve this food system.
And in terms of local partners, we had a comment that Ourbridge is doing a lot right now to feed folks. I believe they work within the refugee community and they are well connected and trusted in the Latino community. I also think the Charlotte Bilingual Preschool is, and in a lot of ways it seems, I've heard of a number of organizations that maybe weren't in food distribution in March that are now in food distribution. So I think that's another interesting avenue to follow. In terms of some larger questions, do you have any examples of communities that have dramatically moved the dial on food insecurity with a concerted effort, and what's been most effective?
So I just had those few examples of things that are in process. I think the Rosa Parks Farmers Market's really showing some outcomes, though I'm not sure if they've had any formal assessment of that. It's changed a little bit in terms of locations and things over the past year. I think one of the biggest challenges I see, and I'll let Abby answer this as well, but we've had so much attention to this and so many efforts for so many organizations, and the dial hasn't moved very much. So while we haven't really been focused on food sovereignty in the past, we've been focused on food insecurity or food access. I'm hopeful that food sovereignty allows us to move a little bit, move the dial, because it is, as I talked about, really this engaged community effort as opposed to something coming from outside. But I think my biggest disappointment in the food system is just that it's been so much effort has gone in, and it's really to kind of keep us where we are, which is great. It's great that there are not as many, that more people aren't falling into food insecurity, but we also haven't really improved. And so how do we do that? I think really takes a re-envisioning of our food system, and that's part of why I'm interested in the State of the Plate assessment.
Now, what role do restaurants play, if at all?
I think they're trying. I think this COVID has really hit the restaurant industry hard, which I think we've all seen and heard and read. And that is another area where their margins are very small. And if they're not open, I mean, it takes a big hit. I think there are restaurants who are working to help feed the communities. I don't know as much about that. I know some restaurants where I am. I'm up in the north part of the county, but there's some restaurants here that are working to feed families and that are opening their doors for things like that. And I know there are restaurants in the area that are doing that. I've seen some open kitchens to allow people to prepare meals to take out and kind of work along those lines, but I don't have a ton of information on that. I don't know if Nicole has anything additional.
We're hoping our survey helps us to highlight some of those efforts. We've seen a couple of things, restaurant or bars going to grocery stores, kind of selling their things to people at cost, just to try to keep them from going bad and things like that. And I haven't seen too much in Charlotte. This was happening before the pandemic, of restaurants going to pay what you can options, which has been successful in other parts of the country where people pay what they can. And so if you're unable to afford a full meal, for more than a couple dollars, you pay a couple dollars. Someone who's better off can pay $30 or $40 for something that might have cost them $20. And so it just becomes a way to try to even out access that way. But I don't think I've seen any restaurants in Charlotte do that, though I may just, there's something new happening every day. And so I feel like I'm always playing catch up on really the innovations happening here. So if you all are aware of anything, in fact, I've got to talk to Abby now about some of the things that she's mentioned. I'd love to hear more about them, because we would love to see what's working so that we can share it with other people and maybe expand those models and to be able to reach more people.
Great. And we're actually at 1:30 now. So if you need to hop off to get onto your other meetings, that is totally cool. But we have, I guess we'll think of this as like a final question for Nicole and Abby. What are some of the most exciting partnerships and collaborations you see in the food insecurity space? Maybe something you haven't mentioned yet. And what would you really like to see in the future?
Yeah, I already mentioned, I saw this question, so I thought I already answered it.
I already talked about all the good things.
Well, so I'll mention one of the new farmers markets. University City is one of the newer farmers markets, and Alonzo Hill has a ton of energy and has really put this together. And Abby knows more about it than I do, but I've just been so impressed by the ability during the pandemic to put together a new farmers market, to bring in new vendors in an area near the university, which we usually don't think about as being food insecure, but does have some really important pockets. And as a professor who studies food insecurity on campus, our students being able to access this, I think, is even more important. So really thinking about the different ways that that has innovated at least my small pocket of the world, I think is really, really important.
Yeah. Yeah, I think I get really energized when I see people use their creativity to do what they can. Using another farmers market, when Uptown Farmers Market opened. So, I mean, we had 2 brand new farmers markets open in 2020 that both participated in SNAP, participated in Double Bucks, and have really done a great job. And that's a big feat. Unfortunately, COVID put a little damper on this, but when Uptown Farmers Market opened, they had worked out a partnership with, I believe it was the Housing Coalition, to use their vans from the church, because they're run through First Baptist Church right there in Uptown, to go to different sites within the Housing Coalition and drive the community to the farmers market to shop and then take them home. So they're looking at, okay, how can we make a small action that has outreach and has impact? So I love to see people running these organizations that are thinking outside the box and looking at the community, and not just looking at running a farmer's market, but looking at the fact that you have a farmer's market that can feed people, that can help expand food security, food access, health, nutrition. What can we do to help the communities, and what partnerships we can create? So I think that's really exciting to see this work expand and get a little bit more exposure and bring more people in to make an impact.
Well, I am super jazzed up.
Sorry, go ahead.
Go ahead.
Nope, that was it. You're good.
Pass over to Patricia to wrap us up.
Right. Well, I just get to say thank you. So thank you to Nicole and to Abby for sharing your time with us. To you, Michelle, so much happens behind the scenes with our Lunch and Learn team. Karen Noble's back here gathering questions. So thanks to all of you for the energy that you have shared with us. Thank you to our members and our guests. We had a number of guests with us today. Please come back and join us for another Women's Impact Fund event. We've got some great stuff coming up. Another Lunch and Learn in March on the environment, I think specifically related to the tree canopy. Our Women Lead program regarding women in leadership, sort of owning our personal power, is kicking off later this month. Again, all of these currently at no cost. If you're able to make a contribution to our annual fund, we would appreciate it. So once again, thank you to Nicole and to Abby and to our Lunch and Learn team. And I hope to see all of you at another Women's Impact Fund event. Until then, I hope that everyone stays healthy and well and takes care of yourself in this strange time. So thank you. Have a great afternoon.
Thank you.
Thank you all.
Thanks.